Okay, great to have you back, and it's time for us to chat. I like to see it as a chat or as a discussion of something that is of great importance in Africa, in Nigeria as well. Now, today we will be talking about first aid and emergency preparedness in Africa, Nigeria as well.
Exactly. Well, there is no gainsaying that in today's world of uncertainties, accidents do happen naturally or man-made of origin anyway. Traffic accidents, for instance, claim several lives each day in Nigeria alone, not to mention other forms of emergencies that go unreported.
So in the light of this, we ought to prepare ourselves for some of these dramatic changes, and that's exactly what we will be looking at today. Our topic is first aid knowledge. We're looking at enhancing emergency preparedness in Africa, of course, focusing on Nigeria. And to help us do that, I am pleased to inform you that we have with us in the studio Akinfosile Dare J, who is an occupational safety and health professional. He also is a first aid trainer, and he is a member of the Nigerian Red Cross Society Divisional Training Advisor for the Mainland Division. It's great having you on the program today.
Good morning, sir. Good to
have
you.
my pleasure. Thank you.
Okay, how do you do?
I'm well.
Do you like my couch?
Come on, Zoe.
Quite cool.
Okay, it's cool, right?
All right.
Okay.
Nice. Okay, so we're talking about first aid knowledge, and we're also looking at emergency preparedness in Africa, in the country. I think I would like to start by definition of certain terms of reference so that we are very clear what we are talking about, so we don't make any assumptions. Terms like first aid, terms like emergency response or emergency preparedness. Would you give us, a description, explanation?
Okay. Basically, first aid is the interface of activities within emergency response. Generally, first aid is the initial treatment, initial help given to someone who has fallen ill suddenly, or someone who has sustained some form of injury in an accident. That's quite basic, but if you enlarge the scope of first aid, you would understand that first aid is a state of mind. It's an attitude where you want to achieve saving lives, limiting deterioration of condition, promoting quick recovery. Beyond that also, first aid seeks to prepare one from basically preventing an emergency, maybe home emergency, road traffic accident. It prepares your mind and then gives you that skill to respond in event of an emergency. Okay. However, emergency in itself is a situation that requires prompt response.
Okay. I think that definition really got me thinking. You said something about first aid being a mindset, an attitude. I just, started having a flashback of how we were taught as a culture, not just as a way of study, as a culture, a way of life to respond, swiftly to incidents like that. So how would you rate, in your field of, your sphere of work for a long time now, how would you rate Nigerians, the people you've communicated with, how would you rate their attitude towards first aid so far?
Wow, that would be difficult, but honestly, it's far below average.
Okay.
It's far below average. The awareness of first aid in Nigeria is poor.
Okay.
Very poor.
Okay. Why do you think, what's the challenge? Why do you think that is?
Well, first of all, there is the mindset that this is the way we are brought up. We should do it this way. It has been working. And usually there is no scientific evidence for some of the things we do. We do a lot of wrong things. For instance, the common practice for you to find people pouring water over someone who has fainted, someone who is convulsing, you find people getting metal spoon, forcing it in between the upper and lower set of teeth, breaking egg on buns, or pouring pap on buns, and they're just
some very mysterious Okay,
honestly.
you're just telling us that, for example. I'm sure some people are also surprised. People are watching and they're surprised to know that. Of course, very soon you'll be part of the show once the phone lines are up and running on the screen. I'm sure you want to also ask some very interesting questions like that. Talking about pouring people water when they're fainted, you said it's not a very
Not very
proper,
not proper.
but it's the norm, and sometimes it seems to work.
That is it.
Okay.
The interesting thing about the body, the physiology, is that your body has been designed to help itself.
Okay.
So whether you are doing something or not, that person within the mechanism of the body has a certain level of response to every form of emergency.
Oh, okay.
Okay, so instead of pouring water on the person,
what do
what
you
would
do?
you rather, do?
In most cases of emergency, you need to preserve body heat. Most cases, from fainting to shock to even emergency childbirth. You watch some of these things on TV, in the movies, and you just see that the ambulance service personnel responds to an emergency, and after putting the person on the bed, on the couch or trolley, the next thing is they are covered with a blanket or something shiny.
Okay.
That is because most emergency situations require, not all, definitely not all, but most of it requires that you preserve body heat.
Body heat, preserve body heat.
Okay, going back to the emergency preparedness, sometimes, you could have certain accidents, maybe road accidents or plane crash. You remember when the plane crash happened, and we were watching on TV. Some of the persons or some of the personnel who were meant to be first responders, like maybe some security personnel, it did appear like they clearly did not know what to do. Perhaps they felt they were not qualified. Maybe they thought you have to be a medical personnel for you to
It's for
help,
the Red Cross or the NEMA.
And then of course, some other people wanted to help. And because they didn't know better, they were doing all manner of things like, maybe pouring of water or trying to move the bodies. And so now, what would you say is responsible for this lack of capacity on the part of some of our security personnel who are meant to be first responders when it comes to certain accidents or certain situations?
They are integrating challenges, but at the very basic of it, it's back to education.
Okay.
What did you learn when you were in school?
Okay.
Were you informed as part of your education that these are the basic things to do? You don't have to really specialize in first aid. You don't have to be a doctor. For instance, I have a background in mechanical engineering, but I started first aid when I was in GSS 1, so 18 years ago. And it's been like that. It's been quite interesting. When you get to the scene, if you are really knowledgeable, when you get to the scene of an emergency response, you almost cry.
Yeah.
You will know that most often than not, our people are not really doing what they should do in terms of helping. They're not really helping. If you don't know anything, if you don't have any form of knowledge, at the basic you should be informed, or you should know that when you get to an emergency scene, you stay at a safe distance.
Yes.
But you find our people, when I mean people, I mean Nigerians, encroaching into an accident scene. Now find a situation whereby even the first responders are not able to respond.
Because there's no
Coming back to the law enforcement agencies or the police or some other institutions, I don't know, I'm not very familiar with the training of the police, maybe in the police college, but the way we can improve emergency response by actually teaching the police how to handle emergencies. Not just in terms of security, that would be the priority. But if I'm a police officer and I'm the first responder, most often than not, the police would be the first institution that gets to the scene of an emergency. Police officers should be able to give first aid. If someone is not breathing and you need to wait for maybe 10 minutes for the ambulance to respond, that person would probably be dead.
Okay, now, in addition to that, don't you think that it also requires a certain kind of mental capacity or mental strength to be able to know what to do in a situation of chaos? For instance, there was just an explosion. There's some people who can't stand the sight of blood.
Exactly, they get
things
traumatized
like
even
that.
by the explosion.
Yes, so, in the light of that, what do you have to say in terms of administering that first aid? Do you feel it does require some sort of mental strength? Or?
I agree to a great extent, because, like I said, the scope of first aid can be very narrow and can be broadened. For someone like myself who has spent 18 years in first aid, we've gone through a series of training, including the one that has to do with building your mental capacity.
Yeah.
When you can as well pick up a book or go onto the internet and read about basic first aid tips. Fine, that can help. But the truth is that if you enroll in a first aid training, if you go onto a class or you find a professional coming to train you it builds your confidence.
Okay.
Even sometimes you get to the scene, some people are aware of what to do, but they don't have the confidence. Some people can't stand the sight of the emergency scene, the blood. You have human bodies littered everywhere. The plane crash was a typical example of that. Collapsed building. Sometimes it can be very disturbing, even for professionals. Okay. But for we professionals responding as a team, there is a debriefing before and after. Your team lead would want to know, prepare your mind to what you're going in for, and then, of course, want to know how you're feeling after responding to an emergency.
Okay, let's widen the scope a little bit now. We're looking at just mostly road accidents and all of that. What about in offices, in companies, business places and outfits, institutions? What kind of training curriculum should be imbibed in those companies, to help the staff, to help the management to manage this? Because, for example, there's an incident in a company, you might not have all the time to wait for the respective authorities and training personnel to come and rescue the scene. So how prepared should the staff be in those cases?
Talking about the workplace, there are about 2.34 million deaths attributed to workplace diseases and accidents. For every 15 seconds that pass by, a worker dies as a result of occupational disease or injury. Most of them are actually due to occupational diseases. Talking also about the injuries, you have about over 300 million non-fatal occupational accidents. So everywhere in the world, people are involved in form of injuries and or accident, including the workplace. So it is at the first point, if once an employer employs someone, they should be able to give basic induction, which includes preventing the accident in the first place, workplace health and safety, and then how do you respond to common workplace emergencies. Basically, you can keep talking about a lot of conditions. You don't have the time in the workplace. Definitely, you don't have the time. So what do you need to do? You look at the common conditions in the workplace, especially the ones that will result into cardiac or respiratory emergencies. So if someone is not breathing now, what do we need to do? Regardless of the position of the person, whether it's the CEO or
the CEO, of course,
the security personnel. So the companies or workplaces should, I'm using this medium to actually encourage them to train their workforce. And of course, a safe business is a smart business.
Okay. Do you think that employers of labor and organizations have really invested in emergency preparedness as it regards the workplace? And if not so, why? Why is that?
Well, I think it's getting better, but I don't think we are there yet. We can do more. So it is in the culture of some organization. Even from the gate, okay, safety exists here. In some places, even from far, you know that.
It's obvious.
It's obvious. It seems the employer doesn't care about the life of the employees. So we can do more. but we are not there yet, in my own opinion.
What kind of campaigns are you into in terms of ensuring awareness, sensitization to different bodies, different institutions currently?
Yeah, from the perspective of the Red Cross, it's about preserving life. It's about respecting human dignity. It's about sustaining life. So whether it's accident prevention or intervention or first aid education, we are really promoting this.
Okay. You know, you mentioned the Red Cross. I know that growing up, we used to have more information about the Red Cross, both in school and out of school. We used to see their presence so much felt. But nowadays, it looks more like maybe when we have football competitions or when we have large gatherings, that's the only time we get to see the Red Cross. So I wanted to maybe let us know what other medium can we reach to the Red Cross, or how can Red Cross as well reach out to us? Because I think that the Red Cross still stands and has its own initiatives and motives. So what ways are you driving information of safety?
Quite interesting. The Red Cross is the largest humanitarian organization. So the presence of Red Cross is everywhere. We know that we are facing certain challenges in Nigeria. You cannot compare the British Red Cross with the Nigerian Red Cross. The kind of support the British Red Cross is getting, for instance, the Nigerian Red Cross might not be getting. I'm not speaking for the Nigerian Red Cross, but that is my own perception as a member who has stayed for 18 years. So I have seen things. I know how Red Cross was maybe when I was in secondary school compared to what it is now.
Thank you. Yeah.
But quite a number of us are still passionate about it. There's Red Cross everywhere. Maybe we should
maybe we should get in contact. But there's an advent of social network and all of that. I'm
yes,
thinking,
well, of course.
Your presence
if you go onto
on
our
the
website, you can search. There are a couple of groups on Facebook that promote Red Cross. We have detachments, we have divisions, we have Lagos State branch and different branches. So once you Google Nigerian Red Cross, for instance, you're going to get options, I'm sure.
Absolutely. Okay, well, if you're just joining, we are talking first aid knowledge, and we have been looking at enhancing emergency preparedness in Africa, of course, focusing on Nigeria. And we're still talking with Dare Joseph Akinfosile, who is an occupational safety and health professional. He also is a first aid trainer and a member of the Nigerian Red Cross Society Divisional Training Advisor for the mainland division. Now you can see the phone lines there on your screen. If you do have any questions as regards what we are talking about today, you are free to do that. Absolutely anything. The expert is here. You you can ask any question that you wish to do. Okay, going back to your experience in first aid, you know, having been a trainer for such a long time, what has been your observation, you know, when it comes to teaching people how to be prepared for emergency situations? You know, are there specific areas that you feel more capacity needs to be built? You know, what has been your experience as regards that?
Okay, quite interesting. Every class presents a unique experience. The common thing is that there is block learning. People, Nigerians, so believe in the way we've been doing things. And sometimes you find trainees arguing with you in the class and say, no, but are you saying what our forefathers have been doing is all wrong? And then you need to try to balance
their knowledge,
the scientific summary, and give good analogy. It's quite interesting. But at the end of the day, you find them slightly convinced and say, oh, some will tell you, I've actually been in a class, and at the end of the class, I had something like, trainer,
thank you,
I believe you. Well, you see,
you've been convinced.
When I get out there, this is what I'm likely to do. And that's a big problem. Even when someone has been informed and is still want to stay within that area he was.
Okay. Well, give us some instances, because I mean, after all this said and done, you've really hammered on the importance of safety. But give us some scenarios, okay? Like you mentioned, someone fainting, don't apply water. That's not the most important thing to do, and all of that. Maybe you should clarify some people. Someone might be at home and have several hazards as well for a home that has babies or a baby. You know, some real life scenarios that we will need to. What kind of safety precautions should we apply in terms of intervention or first aid, like you mentioned?
I'm sure the viewers also picked from your toy.
Okay, because I have picked as well.
That was quite interesting.
Okay.
That's one part, because choking is the leading cause of death in children.
Okay.
And toys are actually contributing to this. So parents should be aware, guardians should be aware. Slippery floors.
Okay.
Don't allow water on your floor. Have basic first aid equipment or basic first aid kit at home. At minimum, you should have disposable gloves. You should have disinfectants. I don't want to promote any brand, but
of course,
have disinfectant
good
and
ones,
read the instruction. Very common practice is that when someone sustains wound, you pick a disinfectant or a particular
brand
and dip your cotton wool into it and start cleaning
Straight
without
onto
reading the instructions. Most of them are concentrated.
Okay.
And then you have to read the instructions to know how you dilute it.
Okay.
It's different from washing. The concentration might be different from when you want to wash or clean the floor.
Injury.
So, but more importantly, people should also find time to enroll in first aid training. First aid training can be as short as a day, depending on the scope. You're looking at 2 days, 3 days, sometimes more than that.
Okay.
But basically, we want to promote accident prevention.
Accident prevention.
Like I said earlier, the scope of first aid is slightly wider than the thoughts of many people. So what you need to do is, there are 3 aspects, which is education, intervention, and prevention. The education prepares you for prevention and the intervention. So people should get first aid education.
Okay. So for instance, you know, still talking about what Philip said, for instance, in a road accident scenario or so, what should be the first thing? Maybe you arrive at the scene and you are meant to maybe administer first aid. You know, what do you do when you get to a road accident?
Especially when maybe you're the only person there before you make all the calls and all that.
When you get to an emergency scene, if you do not know what to do, you've not been trained, you have no idea, or you are not sure of what to do, the very first thing you should do is to get help.
Get help. Okay.
So that is the time you want to dial your numbers. 767 or 112 as per Lagos emergencies number.
Okay.
You dial your call for emergency and then stay at a safe distance.
Safe distance.
If you are not sure of your safety. Because you can actually go to the scene of the accident and escalate it.
Escalate it yourself.
Maybe
That's
by
become a
doing
part of
something.
it.
Yes. And then you can also, at the end of the day, be a victim
yourself
of that.
Okay.
So another common practice is that you find people going to the scene and dragging the casualties
around. Okay.
Sometimes it might be to the best interest of the casualty to just leave them in the position they were found.
Maybe in cases of dislocations and all that.
Because if someone has sustained back injury or spine injury, moving them or dragging them can actually complicate the issue. Okay. And sometimes some of those movements can actually result into the death of the casualty.
Okay.
Well, a lot of us don't know this. You get to an accident scene,
and you just want to
find 2 FT guys or 4 FT guys pulling the legs, pulling the hand. Sometimes you help the person onto the motorcycle.
Wow.
Then you're riding, the person keeps bouncing on the motorcycle. You find out that you're actually transporting a dead person.
Wow.
Gets to the hospital, and in our own situation, maybe it's cultural or something, you will attribute everything to God and say, oh, well,
the person,
it is written that this person will die today. It doesn't have to die.
Yeah.
Most of these accidents are preventable, and the deaths from these accidents are actually preventable.
Do you think we've lost many lives really from emergency situations as compared to even afterwards?
I believe so. I believe so. Although we might not have facts supporting it in our own environment, but I believe so. Because you find a lot of people doing a lot wrong things.
things.
Okay.
Okay.
Okay. I'm talking about maybe policies or maybe government intervention. Is it intervention? Okay, government involvement.
Involvement.
Yes. You know, do you think that we have enough policies or legislations that talk about building capacities for certain institutions? You know, we talked about our law enforcement agencies, maybe the police, maybe the Federal Road Safety Corps, maybe some other organizations. You know, how would you rate government's involvement, or what more do you think that the federal government should do in terms of ensuring that, you know, these bodies, you know, as a matter of urgency, have those things, training and, you know, building capacity for their members?
We can make as many laws as we want to make, but the most important thing is implementing those that we have.
Laws, yeah.
And the question will now be, are we really implementing those laws? Okay, so in terms of law, well, I think we have certain legislations in place. The NEMA is doing well.
Okay.
But I must commend the Lagos State, because I've been to other states in terms of training, in terms of trying to inform people and carrying out few assessments. I think Lagos State, relatively, I'm not saying we are there or Lagos State is there, but relatively, the Lagos State has a better emergency response mechanism in place.
Okay.
You can still walk in the streets of Lagos and find Lasambos or some form of ambulances driving past, or you find ambulance
in
stations.
In certain areas.
You don't see such in many states.
Many other states.
Can we say Lagos is small? So
No, I don't think it's about the population.
It's not about
it's about
even the population.
attitude.
Lagos is relatively the
Also
largest
very
state
high,
in
yes.
terms of population, but in terms of size, it's small. But I would say Lagos is far ahead, in my own opinion, ahead of other states.
Should we privatize maybe this arm of safety? Because I know we have some other companies that are private entities. Many times are they more of profit driven than they should be, really, to pass on information?
Well, everyone in business wants to make money,
Yes.
but they have core values also. So I want to respect the professionalism of such companies. But there are other organizations like the World Safety Organization, the Institute of Safety Professionals of Nigeria, which also I'm a member. So all these organizations, all these institutions are actually promoting safety. And the Red Cross, for instance, is an auxiliary to the government, and we try to work with the government to ensure effective emergency response.
Amazing.
Okay.
Thank you so much.
Okay, and in conclusion for today's discussion, you know, what would be a word of advice for individuals, for corporate bodies, for institutions, as regards being prepared, you know, and as regards having first aid knowledge, you know, like some sort of advice for
You might just help even before the elections.
Yeah.
Yes, the importance of first aid, emergency preparedness, cannot be overemphasized. As individuals, especially in an environment where if there's an emergency and you call the emergency number, you won't get response quickly.
Okay.
You won't get a response in 5 minutes. It's unlikely. Okay, so people should prepare themselves. Don't put themselves in harm's way. For instance, crossing the highway, especially under the foot of the footbridge.
Pedestrian bridge, yes. It's really shocking.
That is the most interesting aspect.
It's alarming.
Where you don't have it, well, you want to give excuses, but you find people at the foot of the pedestrian bridge
and
crossing the highway. So you should bear in mind, I've been to the scene of emergencies, and you are just waiting forever. So people should follow basic instructions, follow traffic rules, fasten your seatbelt. Why is that so much to do? Okay? Just do basic things. Prevent kids, read instructions on every pack, whether it is your phone, whether it is domestic solvents or chemicals, everything. Just take your time to read instruction. All these things are actually there to promote accident prevention.
Okay.
Thank
Right,
you so
thank
much.
you so much. We've been looking at first aid knowledge, and we have been considering enhancing emergency preparedness in Africa, that is focusing on Nigeria. And we did have the pleasure of talking with Akinfosile Dare J, who is an occupational safety and health professional. He is a first aid trainer and a member of the Nigerian Red Cross Society Divisional Training Advisor on the mainland division. Thank you so much for coming
Thank you
today.
for awakening the safety attitude and mindset once again.
Absolutely.
Thank you.
So, having said all of this, I mean, response, emergency preparedness can't be overemphasized. Like our guest has said, we must be prepared. And the only way that we can do that is to be properly informed and to get the necessary training. Who knows? You might just be that person that will save a life or several because of the knowledge that you have acquired. So once again, thank you very much for coming. And thank you also for being part of today's discussion. Let's do this again tomorrow. In the meantime, the morning show will continue right after this next feature. Stay with us.